Thank you, everyone. We're now live, and I'll turn this over to Governor Sisolak.
Good afternoon, and thank you all for joining me in this virtual format today for this press conference. I am not wearing a mask. I am still in isolation in the residence in Carson City, so that is the reason I'm not wearing a mask. As many of you know, I tested positive for COVID-19. I'm feeling good, and I'm currently not experiencing any symptoms. I cannot express enough my sincere gratitude to all of the health professionals who assisted me through this process. As a state, we owe them a debt of gratitude for their continued service throughout this entire pandemic. Although I'm not experiencing symptoms, many Nevadans who become infected with COVID do. My heart goes out to all those who are sick with this virus currently, and especially to the families of the more than 2,000 Nevadans who have died from COVID-19. Not a day goes by where I don't think about these families and their grief. They are constantly in my prayers. As all of you are aware of the escalating COVID-19 cases in our nation and in our state, almost 2 weeks ago, I asked that we step up our efforts to mitigate the spread of this dangerous and highly contagious virus. I've been in constant contact with our health professionals, economic experts, our vaccination preparation team, and many others to assist our current surge and possible next steps. As of today, 13 of our 17 counties are flagged for elevated risk of transmission. In the beginning of October, only 2 counties were flagged. Our state positivity rate is at a record 16.5%, and as I've mentioned, we have surpassed 2,000 deaths. Just recently, we experienced a record number of daily cases, 2,416 in just one day. Our previous record was 1,639 in July. Today, we once again had over 2,000 cases reported, 817 in Washoe County alone, greatly exceeding their previous record. Our case rate growth is at a wildfire level, even outpacing neighboring states such as Arizona. All available models indicate that Nevada is in a red zone, and our health experts anticipated continued case growth based on current trends. In fact, 10% of all COVID cases recorded in Nevada since the beginning of this pandemic were reported in the last 7 days. That's 10% of our total cases have been recorded in just the last 7 days. Every minute, a Nevadan is diagnosed with COVID-19. Our hospitals are experiencing record numbers. And as you heard from Dr. Tony Sloan of Renown a couple of weeks ago, they've started treating patients in an alternative care site in the parking lot. Some of our hospitals are experiencing staffing shortages because they have become infected or their family members have been diagnosed with COVID and workers are in quarantine. Due to massive increase in community spread, we are experiencing significant outbreaks in our institutional settings, including our correction facilities. Our public health infrastructure, from our hospitals to our state health response, is quickly becoming overwhelmed. And from the start, I've made clear that in addition to saving lives, one of the main goals of our response is to protect our public health system and our hospitals from being overwhelmed. Let me explain this quickly. Whether you believe in the science of COVID or not, the reality is this. It's simple. COVID is filling up our hospital beds, and that threatens all Nevadans. If hospital beds continue filling at this rate and staffing shortages continue to increase as they are now, that means all Nevadans will have limited access to the care they may need. It's not just for COVID. If you get in a car accident or have a heart attack or break a wrist, you won't be able to access care if our hospitals are full and there isn't enough staff. This is our biggest threat. You saw it in New York. You can see it now in El Paso. This cannot become our reality. There is a consensus on one inescapable conclusion. We are in a rapid trajectory that threatens to overwhelm our healthcare system. our frontline health workers, and your access to care. So it's time to act. From the start of the pandemic, there aren't any decisions that don't have negative consequences. Weighing the loss of jobs and businesses versus the loss of health and lives is painful without a perfect solution. While prioritizing the health and safety of Nevadans, I am also balancing the significant ramifications that further restrictions will have on our suffering economy. No state struggles with this more than Nevada due to the lack of diversity in our economy. I've mentioned this High Wire Act before, this Great Balancing Act, and it feels like we've been living in this no-win situation for nearly 9 months now. And believe me, I understand the stress, emotionally, mentally, economically, that you are all going through. Today, I'm announcing new restrictions in an effort to get this wildfire under control. I am not issuing a shutdown order. To repeat that, I am not issuing a shutdown order. My goal is to aggressively try to attack this spread while maintaining some portion of our economy and our daily lives. That's why I'm announcing that effective Tuesday at 12:01 a.m., Nevada will be operating under a statewide pause with the following conditions in place. We will keep these restrictions in place for at least the next 3 weeks. At least the next 3 weeks. I'll talk more about the next steps soon. First, I'm strengthening Nevada's mask mandate across the board. Nevadans and visitors are now required to wear a mask at all times when you are around someone who is not part of your immediate household, whether indoors or outdoors. This expansion includes requiring masks during private gatherings. I will talk more about private gatherings in a minute. In the last month or so, new research has emerged that continues to validate the importance of wearing a mask. They continue to be an essential tool in our fight. Going forward, we will reduce capacity in certain high-risk areas that have been shown nationally and in Nevada to contribute to the spread of COVID-19. Under the statewide pause, no additional businesses will be closed, but capacity limits and new mitigation measures will be imposed on both businesses and gatherings. I will start by explaining what's changing. Restaurants and bars, they are currently operating at 50% capacity. Under the statewide pause, they may continue to operate under strict social distancing requirements at 25% occupancy, indoor and outdoor. No more than 4 patrons per table, and seating at bar or countertops must continue to be socially distanced under the existing guidelines. Restaurants and bars should continue to have hand sanitizer available and should be conducting health screenings and/or temperature checks. For restaurants and bars that serve food, reservations are required. No walk-ins will be allowed. I know the majority of our bars and restaurants are doing their best, but these settings are proven to be high risk because they allow the opportunity for people to remove their face coverings in indoor settings around people outside of their households. That's how the virus spreads. That's why I encourage curbside delivery and/or carryout operations, and why our healthcare experts want to remind Nevadans and visitors that you must keep your mask on at all times when you are not actively eating or drinking. Regardless of whether you are 6 feet away from others or not, you must maintain your mask at all times when not actively drinking and eating. If you choose to dine indoors, keep your mask on as much as possible. I encourage restaurants and bars to try to expand outdoor seating options. And I encourage local governments to work with these businesses to meet this goal. Gyms, fitness and dance studios, and places like martial arts studios currently are operating at 50% capacity. Under the pause, they may operate with no more than 25% occupancy under strict social distancing requirements. We are strengthening our mask mandate with no exceptions for indoor exercise. Masks must be worn at all times unless you are actively drinking. If the activity is too strenuous to be done while wearing a mask properly, you must seek an alternative exercise. Other businesses that will be moving from 50% to 25% capacity during the pause include the following: museums, art galleries, libraries, zoos and aquariums, arcades, racetracks, bowling alleys, miniature golf, amusement and theme parks, and other similar activities. Additionally, gaming operations will be restricted to have no more than 25% occupancy and must operate pursuant to requirements issued by the Nevada Gaming Control Board, including health and safety policies. Restaurants and bars within gaming establishments will be restricted to the 25% capacity under the statewide pause. Public gatherings. Recently, we took great steps to increase gathering size to 250 people or 25 or 50%, whichever was less. Unfortunately, due to the surge we're experiencing, we must decrease these limits during the pause. Public gatherings will be limited to no more than 50 individuals or 25% of fire code capacity, whichever is less, under strict social distancing requirements. This includes places of worship, indoor movie theaters, live theater performances, casino showrooms, weddings, funerals, celebrations of life, milestone celebrations, and any other event where members of the public may be gathered together at the same time in the same place for the same purpose. No large gathering plans will be approved during this time. Again, all gatherings must be limited to 50 people or 25%, whichever is less. If larger events have been approved to take place in the next 3-week period, they must be canceled. Private gatherings. In addition to public gatherings, this statewide pause will also include new and necessary limitations on private social gatherings. We know a significant source of spread is right in our homes. We must do all that we can to prevent it. Under the statewide pause, private gatherings will be restricted to 10 people or fewer from no more than 2 households, whether indoors or outdoors. 10 people or fewer from no more than 2 households. As I said before, face coverings will now be required in both public and private settings whenever you're with people outside of your household, even if you're socially distant. And while I beg all Nevadans to listen to our health experts and the CDC by only spending Thanksgiving with your household members, if you choose to gather with those you do not live with, you must all wear masks. Additionally, there will be a pause on adult and youth sports tournaments during this period, effective Tuesday morning. There will be a pause on all adult and youth sports tournaments. Retail establishments, including malls, will not have to change their capacity during the statewide pause and can continue operating at 50%. Retail grocery stores retail and grocery stores with over 50,000 square foot capacity will now be required to have employees at all public entrances counting patrons to assure compliance with capacity limits. Again, I want to strongly encourage and promote online ordering, curbside delivery, and/or carryout options. As a reminder, every business venue and gathering space is required to post capacity limits under COVID-19 directives at all public entrances. You can find downloadable capacity signs on the NV Health Response website. Now, what won't change under the statewide pause? Brothels, adult entertainment establishments, day clubs, and nightclubs will remain closed. Again, retail establishments will not have to change their capacity limit of 50%, but some will have new mitigation requirements in place. Additionally, the following businesses can continue operating under the current standards and will not have to adhere to new restrictions under the statewide pause. Hair salons, barbershops, nail salons, and businesses that provide aesthetic skin services. Spas, massage therapy, and massage establishments, body art or piercing establishments. Finally, community and recreational centers will continue to operate at 50% capacity, understanding that they provide critical childcare services during this time of need. I want to be clear that the new public gathering limits do not apply to our school districts in Nevada. And I want to take a few minutes to talk about schools now. The very first emergency directive I issued after declaring a state of emergency back in March was to temporarily close schools. At that time, none of us could have imagined that we would have some children in our state who had not set foot in a school building for more than 8 months. Since I made the difficult decision to close schools and their buildings, we have seen our infection rates and risk factors increase and decrease in response to actions taken. That includes actions that government has taken in regards to testing, to issuing stay-at-home orders, closures, and the gradual reopening of our economy. But it also includes actions that have taken as individuals in response to whether or not all of us are doing everything we can to keep our neighbors and our families safe, whether we wear our masks and refrain from taking unnecessary risks. Let's be honest, our casinos, hotels, restaurants, and bars are open with strict restrictions so that we can protect our economy. Meanwhile, the majority of our school buildings across our state are closed, and our kids are suffering as a result. Our education system and our economy are not mutually exclusive. They are tied together. As long as school buildings are closed, our economy cannot be fully open. Mom and dad can't go to work if they have children learning from home who need supervision. We must reprioritize keeping our kids in the classroom or getting them there. Throughout this crisis, we have been talking about protecting our vulnerable populations. While children are not as physically vulnerable to COVID-19 as elderly or medically at risk, that certainly doesn't mean they are immune to its effects. They too are vulnerable in this pandemic, and they desperately need all of our support. As I said, we have students who have not been inside of a school building in over 8 months. And while we're doing everything we can to provide community support for some children, that could mean that they have not had access to reliable food, to safe shelter, or to caring adults who can intervene immediately if something isn't right in over the last 8 months. We've talked about wearing masks to protect our elderly, our parents, and our grandparents. And we've talked about staying home so we can keep our economy open. Today, I'm asking you not only to follow through with these tougher restrictions during the statewide pause for the vulnerable and our economy, but to do it because our children deserve our support. We have seen more deaths by suicide among students this fall than in years prior. And it breaks my heart to share that victims have included students as young as 8 years old. We are in a pandemic, which caused an economic crisis, which has created a mental health crisis. And getting children back into school buildings is a key way that we can ensure that they are getting the education and support that they desperately need and they deserve. That's why we must do everything we can to help prevent the spread. That's part of why I am putting Nevada in a 3-week statewide pause with restrictions I just spoke about. The restrictions I outlined tonight apply statewide. They are baseline standards for all of our communities, but I would be remiss not to remind local governments of their ability to enact stronger measures, especially if your local public health officials are giving you recommendations or if your hospitals become overwhelmed. or if you experience outbreaks in your counties. Take action. The measures I'm announcing tonight, our statewide pause, will be in effect for a 3-week period. Throughout this pause, we'll be evaluating our situation and looking for signs of concern or improvement. We will monitor our transmission rate, the slope of the epi curve, and our percentage increase of cases. Depending on the trends, Nevadans can expect a few outcomes. If our percentage increase of cases begins to slow and our epi curve begins to plateau, we will make an evaluation of whether it's a consistent trend or whether we need more time under these restrictions to ensure that the downward trajectory stays in place. Or we may consider slowly loosening back to the restrictions currently in place. The numbers and the virus, as well as our individual and collective actions, determine the timeline. If this action is not taken seriously and our situation worsens in the next 3 weeks, continuing the current trajectory that threatens our healthcare infrastructure, I will be forced to intervene and to take even stronger actions. Stronger actions will be targeted at high-risk settings and may include the prohibition of indoor dining and service at restaurants and bars, closure of gyms and fitness facilities, severe restrictions on gathering sizes. That is what our future holds if our trends do not improve. As your governor, I am confident that I did all I could to avoid further restrictions and keep us on the path forward. But now I must act. I am hopeful that these restrictions announced today, going into effect on Tuesday, will help reduce our caseload. I don't want to impose further restrictions. We are too close to the real solution, the vaccines, to give up now. I remain encouraged by the developments with the Moderna and Pfizer vaccines. There is a light at the end of this tunnel, and we are getting closer, but we do not have a vaccine yet. There is no doubt that this surge is a global and national problem, but it's our problem as Nevadans to fix what we can fix within our own state. So in this moment, with these new restrictions, and with that optimism on vaccine programs in mind, I'm asking all of Nevada's leaders, business, labor, religious, elected, associations, academic, and many others, to intensify your efforts even more, to educate, inform, and model what is required of all of us to bridge the gap to the vaccine, to fully reopen our lives and to propel Nevada forward once again. I implore you to tap into Nevada's independent spirit in this moment and consider your own personal responsibility. We decide our distance to others. We decide how long we spend in a high-risk setting. We decide whether we're going to prioritize getting our kids into the classroom, allowing our business to operate by following responsible measures and protecting our hospital system. If it doesn't feel safe, it isn't safe. Be determined, offer help, and hope to others. Believe in our future and know we are closer to the end than to the beginning of this terrible pandemic. Thank you. I appreciate your indulgence, and I will now take some questions. I believe my staff is on the Zoom to facilitate this process.
Thank you, Governor Sisolak, and thank you everyone for joining us. So we do have some hand raised. This is Megan Delaney, Governor Sisolak's comms director. So I'll be calling on the folks with the hand raised. And then if you could, I think you can unmute yourselves if you're on a computer using the button. If you're on a phone, you might need to dial *6. We'll go first to Vanessa Murphy. I see your hand raised. Vanessa Murphy, channel 8. If you could try to unmute yourself, and then you can ask the governor your question.
Thank you for taking my question. Governor Sisolak, how do you plan on enforcing, for example, limitations on private gatherings and also this stronger mask mandate you're referring to?
Well, we are certainly not the mask police, but I have done everything I could to help spread this virus. It's now incumbent upon all of us as residents of Nevada to do our part. I hope that people understand the science that we're dealing with, the medical and healthcare realities that we are dealing with, and that they will comply with the directives that are in place.
Thank you for your question, Vanessa. We'll go next to Megan Messerly of the Nevada Independent.
Hi, Governor. Thanks for doing this. I know some businesses, especially some restaurants, have previously said that they just can't make ends meet at 25% capacity and are going to have to shut their doors. They just can't run a business with the overhead. So why limit those businesses to 25% capacity and not have them close completely?
Well, a lot of these businesses, I think, can operate at 25%, and with the curbside delivery and with the takeout joined in there, it's our hope that with the PETS money that we gave out recently, we're doing everything we can to help our small businesses. This is a 3-week pause, and we're hopeful that the community will support the businesses through other methods, be that delivery or takeout, but the capacity will be 25%. It's up to them to decide if they want to open at 25%.
Thank you for the question. I think I passed the host back over to Randy because I'm not good at the Zoom, but we'll do next question from Bill Denser of the RJ. Bill?
Thanks, May. Hi, Governor. My question was about whether in formulating these new restrictions, you spoke and engaged with the counties and their health facility, their health organizations to coordinate. Again, this kind of goes to the enforcement question, how they will carry out the mandates. I mean, did you have interaction? Did the state have interaction with the counties? And are they aware of what's coming and are they supportive of it?
Well, we did have interactions with all of our partners, be those the counties and the cities in the different jurisdictions through the COVID task force and other phone calls. It is my hope, and they always have the option to make stricter restrictions. Unfortunately, that has not happened to date, and the time has come that I had to take a stand. I had to implement stronger restrictions. Washoe is breaking records on a daily basis. I have to do something. And that is the reason that this was done in consultation with all of the various groups, our health professionals, our business professionals, our community partners, and I'm confident that this is the right thing to do for our state.
Thank you, Governor. We'll go to Sam Metz of the AP next, please. Sam?
Hi, Governor. Thanks for taking my question, and I'm glad you sound a little better. Are you glad you have the ability to implement such complex and pinpointed restrictions, or do you wish there were more uniform national standards for the pandemic?
I certainly wish there was a more unified national standard. We could have been much better off from the beginning had we implemented mask mandates and social distancing and those sort of things. Unfortunately, the task force, the COVID task force and the administration did not choose that avenue, and governors were left to deal with it on their own. And I talked to my gubernatorial colleagues on a regular basis. Different states are handling it different ways, and Nevada is different than some states. We have basically in Southern Nevada, a one industry town that we have to try to balance the benefits of opening up and protecting our health. And I'm confident that we made the right choice by limiting it in this manner.
Thank you. We'll go to John Sadler of the Sun, please.
Hi, Governor. Can you hear me?
I can, John.
Hi, Governor. Well, thanks for doing this. I wanted to hop back to something you said in your remarks when you were talking about the importance, of the economy in making these decisions. Why did you go with these restrictions rather than a shutdown of businesses like earlier in the pandemic?
Well, early in the pandemic, we had a total shutdown, John, and the effect on our economy was devastating, and our unemployment hit an all-time high. I'm confident in discussion with the industry experts and with our health experts that if we operate under these protocols, we can keep our employees, our residents, and our guests safe. I'm confident that working together, that's a reality. That's not a possibility. The spread is not necessarily confined to hotels and casinos. It's the gatherings and the interaction, the group that creates the spread. So we've done everything we can to minimize that interaction, that social interaction, to keep everybody as safe as possible.
Thank you, Governor. We'll do the next question with Madison McKay. Madison, please.
Hi, Governor Sisolak. Thank you so much for taking the time. Will you encourage or talk to county commissions and local governments to enact tighter restrictions that are more specifically targeted to those areas, for example, indoor dining in certain counties?
Well, for months now, we have given the local jurisdictions that flexibility, that authority to institute tighter restrictions. Unfortunately, until now, they have not done that. And the time has come, with the cases rising as quickly as they are, that something had to be done. So I stepped up and we're implementing these restrictions. If counties choose to go further, I support them in that decision. We will be in constant communication and contact with them and provide any support that's necessary. But ultimately, they will have the final jurisdiction in their area. They can make restrictions more restrictive, but not less restrictive. And that'll be left up to them on an individual case-by-case, county-by-county basis.
Thank you, Governor. We'll go to Howard Stutz for the next question. Howard, if you could try to unmute yourself and ask your.
Hey, Howard.
There I am. How are you doing, Governor? Good. I hope you're better.
I am, thank you.
How do you enforce the 25% limit on casinos, on the strip casinos, especially coming up with Thanksgiving holiday? And I'm not sure what the visitation numbers are yet for that, but how do you go about enforcing that?
How I go about enforcing that is we are in constant contact with our Gaming Control Board and our new chair, Bryn Gibson, who I'm extremely proud we have him there. I mean, Sandra was terrific, and I know Bryn will do a great job. I had conversations with most of our gaming operators in the past 24 hours. I can assure you that the full force of the Nevada Gaming Control Board will be behind the implementation and the enforcement of these 25% requirements. And if they don't follow them, they will suffer the consequences as delineated by the Gaming Control Board.
And Governor, the restaurant requirement for reservations, that falls into the casinos themselves also. The restaurants there, they have to have, those guests have to make a reservation, no walk-ins in those restaurants, correct?
That is absolutely correct. All restaurants will be required to have a reservation system in place, and people will have to make a reservation in order to get a table.
Thank you, Governor. Hope you're feeling better.
Thanks, Howard. Appreciate it.
Thank you, Howard. We'll go to the next question. Fox 5 Las Vegas. I'm not sure who the reporter is on the line, but Fox 5.
Hi, Governor. So my question is Dieter prepared for another potential surge of applicants, say if restaurants or bars decide to shut back down due to these restrictions?
Well, I'm hopeful that they won't shut down. I'm hopeful that they'll be able to, make it based on the 25% capacity. I know it's asking a lot of them. But I'm hopeful that the takeout and the delivery business will increase as a result. And it's for a 3-week period. I'm confident that if we get everybody complying and pitching in, that it'll be a short time. It'll be 3 years, but Dieter's aware of what the restrictions are in place and will handle anything that comes forward as best of their ability.
Thank you, Governor, and thank you for the question. We've got time for a couple more. We'll go to Bob Conrad from This Is Reno. Bob?
Hi, thank you, Governor. Can you hear me okay?
I can.
Thank you. You mentioned getting kids back into school. The Washoe County School Board on Tuesday, I believe, is going to be voting to go to full distance learning. And I believe part of that, in addition to the increasing cases, is the reduction in available resources, such as staff and subs. Are you recommending that they not go to full distance learning?
Well, my recommendation is that they consult with our superintendent, Joan Ebert, who's been working with all of the various superintendents. I can tell you this, Bob, that the cost mentally and emotionally of not getting these kids into a classroom and having in-person education, at least part way, is devastating. We need to get the kids in the classrooms, and we can get them in the classrooms. If we can get everybody to pitch in, if you want to get the kids back in the classrooms, you want to get the teachers back in the classrooms, help us out. Wear the mask, socially distance, limit the group size gatherings. Those are the kind of things we need to do to get our economy back going, to get our businesses back open, to protect our vulnerable, and to get our kids back into classrooms where they need to be. It's been 8 months since kids have been in a classroom. That's unacceptable for kids.
Thank you, sir.
Mhm.
Thank you, Governor. I think we'll take one last question from Andrew Davey, and then we'll be able to wrap it up here, Governor.
Okay.
Yes, hello, Governor. To follow up on some earlier questions, how do you feel the federal government's response thus far has helped or hampered your efforts and the efforts of our local public health authorities to contain COVID-19?
Well, the lack of a national plan has been devastating to all of the states. And all of the governors have basically been left on their own to deal with this situation, to procure PPE, to come up with a policy, to come up with restrictions as it relates to healthcare. Or if something as simple as the encouraging of wearing of a mask would have happened nationally months ago, we would be in a lot better position than we are right now. But we're not. I mean, the reality is we're not in that position. And I'm hopeful that a new policy will come forward in the distribution and the use of the vaccinations, the vaccines that are going to be made available, so that we can get them distributed in a fair manner to all of the states and to all of the people that need it in the most expeditious manner possible. And that needs to be done on a national basis. You cannot have every state fighting with every other state in order to try to procure these things. We need to have a national plan in place, and it's my hope that we do that.
Great, thank you, Governor. If there are any,
There is, and I want to just add there is hope. These vaccines they're talking about, potentially some of them coming out next month and into the first quarter of next year. As I said in my remarks, there is a light at the end of this tunnel. We're closer to the end than we are to the beginning. And that's what should give us some hope. And this is the time that you need everybody to just reach down. And I know we've asked a lot, and I'm asking more. This is the right thing to do. And I'm asking everybody to please participate, do what's best for you and your families.
Thank you, Governor. And we actually will take one last question from Telemundo, if you don't mind, and then we can wrap it up for the evening. So Telemundo, if you could unmute yourself and you can ask the governor your question.
You consider, yes, Governor Sisolak, are you consider any kind of penalty for those who doesn't follow this new mandate?
Well, certainly there's going to be ramifications for those that don't, as Howard Stutz asked earlier with gaming. With the gaming in the gaming venue, we have the Gaming Control Board that has pretty much great latitude in determining what the penalties would be. I'm hopeful it won't come to that. I'm hopeful that people will do it. But local jurisdictions, business licensing, code enforcement, B&I, OSHA, all of the enforcement agencies are going to be made available, and they're going to be out enforcing these new restrictions. But it shouldn't be that somebody has to come in and enforce them. It should be that people understand we want to protect our businesses. We want to protect our vulnerable, and we want to get kids back in classrooms. And if we work together, we can make all of that happening by everybody doing their part.
Thank you very much, Governor Sisolak.
Thank you.
Thank you, Governor. We'll have a press release out to media after this is over, and I'll be able to take any additional questions that folks, if they weren't able to join the Zoom, will be able to take those via email. So thank you very much, Governor. If you have any closing remarks before we end the Zoom.
No, I want to thank everybody first off for their outpouring of concern about my health. I appreciate that. I'm very thankful that my symptoms were minor. And again, I want to thank and congratulate the incredible frontline healthcare workers that we have here in the state of Nevada and those that took care of me. And I appreciate that. But this disease is nothing to mess around with. You can take all the precautions and still be infected. It is extremely contagious, but we're not at its mercy. We can do so much if we just all work together and everybody does their little part. I understand that people are going to get together, but shorten your group public gatherings if that's what you have, and try to protect yourself as much as possible and thus protect your families and your loved ones. So with that, thank you all very much and God bless.
Thank you, Governor. Thank you, everyone.